So I'm very glad to be the presenter of today's session. I thank DIA for inviting me to talk about on ensuring safety and comfort in the home. So, I hope, I know very well that you are all the caretakers of your loved ones, and today I'm here to discuss about how important the home safety is, and how, as a caregiver, you can provide a safety environment for your uh, person with dementia. So here today I'm here to discuss about two important topics. One is fall, the other is wandering behavior. So, because why this two topic is most important? Why? Because we know very well that elderly people are high risk of getting fall, and most of the fall happens at home, and even the elderly people, uh, person with dementia can live for longer life, but without any much physical deterioration, but the fall can lost a life within a second. So this is the most important issue that a family member of the caregiver should definitely know about it, and how can we provide a safety environment for the person. So first we'll start with the introduction about the falling. So I told you I'm going to discuss about the two topics. One is fall and another is a wandering behavior. So first let me start my discussion with the fall. So what is fall? It is like when you think about the other deadly disease conditions like cardiac arrest or other deadly diseases. So the fall is not causing that much shock to our mind, but it can cause a what say a worst scenario in our home. So falls are too common in the geriatric population, that is elderly patients or persons are high risk for fall, and they may have a bad consequences also. So according to the study, it says like the leading cause of injury and death by injury in adults over the age 65 years is the fall, and one of the three community dwelling older adults fall each year, with 24% of those fall sustaining serious injuries and 6% sustaining fractures. So, due to fall, the person may experience pain, hospitalization may require for the patient, even they may land up in major surgical interventions like hip surgery or repair of the fracture, other things, and admission to a hospitalization, and also it may lead to overall functioning ability of an individual. Like if a person falls, that may disturb his mobility, and from that time period onwards, he may become dependent to the caregiver, and that is more burden for the caregiver, and it is more distress for the individual also. So here the overall functioning ability is getting declined. The other reason is, one of the reason is, once the patient had fall and there is no much injury has happened. So from that time onwards, the person will feel anxious or fear about falling. So they never walk, and they never take risk in doing the activity, and that is why their physical mobility is getting reduced. Once the physical mobility is getting reduced, naturally that is a high risk for making them to bedridden. So this is most important topic to be get aware of for all the family members, especially those who are taking care of the elderly. So why fall happens in elderly? Why? Because there are some physiological changes taking place in the elders, like stiffened joints, their muscle strength will decrease, and there is some neurological problems, and they may have other comorbidities like diabetes and hypertension, which may cause some neuropathy, loss of balance in making motor activities, their coordination. So all of the so many risk factors are there for elders to make them the risk for fall. So there are mainly three factors which we can talk. One is related to health, it can be related to environment, it can be related to their behavior. So I just raise you a question whether falls can be prevented or not. Like yes, definitely falls can be prevented. In what way? How we can prevent the fall? So we can prevent the fall by three ways. One is lifestyle changes, exercises, regular health checkup, and more than this, environmental modification. So as a caregiver, you are in charge of providing a home safety, that is a good environment for your caregiver to prevent the risk for fall. So what are the risk factors for fall? So if previous fall, if the patient had recently or a back or 3 months ago, if they had a history of fall, they are the high risk people who may get the chance of other. Then decreased strength. Those who are as age increases, your physical strength or their muscle strength is getting decreased, and that is also one of the major risks. And gait or balance impairment, if they are unable to walk properly, if they have some balance disturbances, if they have any other motor problems, that may also increase the risk for fall. Then use of some medications. So some medications can cause dizziness, we call it as orthostatic hypotension. Suddenly, if they rise from bed, their BP goes down. So if they rise from bed, they do not aware about the environment, and suddenly they may fall from bed. And due to elderly people, they may have visual impairment due to some cataract or any other vision problem, and depression also one of maybe the cause. And also the other risk factors like orthostatus, as I have mentioned earlier, and functional limitations. If they are not doing much work, and that will also decrease their muscle power. And as age increases, the risk for fall is also increasing. And when they have the low body mass index and urinary incontinence, yeah, definitely people may have, like for male people, they may under high risk of getting BPH, benign prostate problems. For that, they may have some. So with urgency, they may rush to the restroom, and with that, they may slip and fall. And cognitive impairment. So cognitive impairment, like talking about Alzheimer or dementia, the people will have disorientation. The people may not aware about the environment. So that may increase the confusion, agitations, and the risk for fall. And if the patient have physical problems like arthritis, diabetes, or untreated pain, these are all the various risk factors which may increase the risk for fall among the elderly. So as a caregiver, you should analyze what are the problems or what are the risks being with your family member, and so that we can prevent it to certain extent. So preventing fall, so as I told you, the environmental modification is playing a major role, and as a caregiver, you are charged of providing the good environment for the elderly. So here I'll just discuss about few points about the how the elderly or the person living with dementia, how their environment to be modified accordingly or friendly to them. I'll discuss with like according to the rooms. First, I'll just enter into the floors or stairways or hallways. So here what you can do is just for every stage you can put the side rails so that whenever they walk independently, they can catch hold of the side rails and they can walk with support. And the second is good lighting. So proper lighting facility is most important. Otherwise, you can that may land up in confusions and disorientation of the rooms, and they do not know what is where the furnitures are or where the cables are running. So they may slip and fall. And consider using motion activated lights that plug into electrical outlets, like some wires and all will be going, some chargers will be going, cables will be running here and there. So these all are high risk, no? They may just have a stuck and fall. So in such a case, when proper lighting is there, so that they can able to see properly and they can able to walk it. So if even this lighting should not be in the daytime also, but all especially during the night time, there should be a proper lighting from their bed to the restroom so that they can there should be the area, the space should be free enough to walk, so that then there will not be any hindrance. and that prevents the fall. And keep areas where you walk tidy. Don't leave books, paper, cloth, shoes on the floors or the stairs. No, just like that, keeping all the things on the floor. So that makes them to slip and fall. And if you are using any floor carpet or any floor mat, that should be properly stuck on the floor so that it will not make them slippery. And you should not throw any rugs or those things on the floor. And if your what say, if the floors are wet, use some caution and tell them that the floor is wet until dry. You don't come out of the thing. So these all can prevent the fall in the fall. So when we talk about the washrooms or the bathrooms, so here you will be most of them will be knowing that there is an elder friendly bathroom assisted services have come. So you can use a grab bar on the both the side of the western comet, so that they can, while rising and while sitting, they can use the side rails with support. And the floor should not be, because uh, as per our experience, we could see like so many people are fall in the bathroom because the floors are very wet. So we should use the non-slippery tiles. You can use some non-skidding slippers, so that that may give some support when they walk on the wet floor. And you can also have some side rails or supportive bars on the thing, so that even when they take bath or even when they walk, no, they can use that as for the support. And proper lighting should be there even at the night time also. The bathroom should be well lighted, so that that will help them to uh, reach to the area properly. So regarding the bedrooms, so when I talk about the bedroom, put night lights and night light switches close to your bed. So some switches are kept near for their accessibility only, because no, like it will be dark when they get up. They have to walk few yards to switch on the light. That's quite difficult for them. So from the bed only, they can, it can be easily accessible. You can just make some accessibility so that they can switch on the light. Then they can get up from the bed. Then also you can, otherwise, you can just place the mobile phone near to their accessibility, so that they can, with their hand reach, they can take the mobile, they can switch on the torch, and then they can come out of the bed. And also, like this, in any emergency, or they cannot able to stand up for anything, they can just make a speed dial of their son or the daughter who is staying in the next room. They can come and take for any emergency. And in case of kitchen, so the elders, because now they cannot climb on the stools, they cannot reach to the thing which is kept under the thing, they can't bend too much. So in such a case, water, according to their reachability, where they can reach to the utensils, they can keep accordingly, so that they can keep and take it outside. So always know, like we advise for the family members, never make them dependent by giving them, by feeding them, by doing all the activities for the person with dementia. Always make them as independent as much. Let them, if them if they are ready to, if they can able to take bath by himself, let him. If he can able to prepare a tea, you just allow him to prepare a tea. So you don't make him completely dependent by making everything for them. So that is one of the activity also, that is one that will stimulate their brain cognition also. And it is both helpful for both their physical health as well as their mental health. So when the kitchens are filled with any waters or something, no, you should clean it immediately. And also, what say, like you can provide some chairs or stools, no, at homes. Like you can, in the kitchen you can provide some table or stool, or in the dining table, let them sit and just cut the vegetables. Let them just do whatever, how much ever they can want, they can do some involving in some kitchen activities, that will be good for them. And regarding the outdoor spaces, so here, if in some houses they may have a lawn outside, or some houses will be on the road where the busy traffic or the transportations may go. So in such a way, they are high risk of getting into an accident. In such a case, you see to that the front door is locked, and otherwise if there is a lawn they can able to walk over the area. So these all such things no can prevent a fall in the home. So here I'll just show you a slide where home safety tips for older adults. So first I can talk to you on about the which I have discussed earlier. Install a ramp with handrails to the front door and remove area rugs or carpets or the floor mat, whatever it may be, which may cause fall, and ensure good lighting. That is most important even at the night time. Install grab bars near toilets and the tub or shower, and reduce fall hazards with non-slip strips on floors or surfaces that may get wet. So these are all some of the tips which this has been I have taken from National Institute of Aging. And also I would like to share the additional points on to prevent fall, like here we have certain what say like options of smartwatches which can assess the fall, and that can be tied to your loved ones. So when they just had the fall, incident of fall, that can be immediately intimated to the family members through a mobile, so that they can immediately they can attend to the home and take him to for an emergency. And always in your mobile phone, or the patient's mobile phone should have their family members or the son or the daughter's mobile number in the speed dial, so that when even when they fall, they can, if they have mobile nearby, they can just make a speed dial and reach to them and report them about their fall. And there are some smartphone home devices, like now some smartphone we can be able to have an camera, CCTV camera, which is being connected to the mobile app, or some sensors are there. Even when they fall, that can be intimated to the family members. So these are all some smart devices which help the relatives to identify or to attend to the person when they are falling down. So to create an elder-friendly environment, that is most important. As I told you, prevention of fall can be prevented. So that can be done by creating a good family environment. Sorry, a friendly, elder-friendly environment. So this active aging reflects the idea that people should be able to continue to participate in all spheres of life. So my patient or my mother is being diagnosed with dementia. I cannot take him out because it is a great danger. He may miss out. He doesn't have the memory. So it's not like that always keeping him inside the room closed. So they need to participate in other activities which can be supported by the family members like you. So physical and social environment are key determinants of whether people can remain healthy, independent and autonomous long into their old age. So these three things are important. They should be healthy, independent and autonomous. So all these things can be assisted and supported by the family members. So, by creating this elder friendly environment, you can empower both their physical and mental health. You can just make them social inclusion. For example, like the people can be bedridden, so you can just use some smartphones and you can just make a video chat with the loved ones, with the relatives staying outside. So that makes them a social inclusion and active participation. And as I told you, you can ask them to prepare a tea. You can ask them to prepare whatever like simple dish. You can assist them. So these all brings them autonomy and helps maintain this all activities helps them to improve their quality of life. So that is our major goal. So there are 6 tips simply speaking, to prevent fall, one is talk with your healthcare provider about medication side. If there is any medication side effects, to consult with your doctor. And second is do strength and balance exercises. So, like even in dementia elderly care in Kasturi Nagar, no, like there is a physiotherapist who is doing regular exercise for the residents. So that helps them to improve their muscle and motor power. So the simple exercises will improve their muscle strength. That also indirectly helps in preventing fall. Then make your home safer by using night light, installing, as I have discussed before, the carpets and the bars and etc. And always check the vision to be tested. And when you're getting up from the bed, stand up slowly, sit it for few seconds. Then after getting up from the bed, stand for few seconds. Then you make sure that the patient is all right. Then they can make a step forward. And if there is any assistive device necessary for them to walk, they can use some walker or cane, no, so that gives them the support to walk. So this I have discussed earlier, like staircases and non-slippery floors and elder-friendly restroom. So these are all the things which helps you can provide for the person with dementia or generally for any elders to prevent fall at home. So this I would like to quote. Japan is one of the most what say largest population in elderly, and in their place in their country they have various supportive services where the community is providing for the community is also elder friendly, not only at home. So you can see some devices to climb into the train, and there are a mall for Tokyo's elder friendly malls are there where they can have a seating, more seats or chairs to be seated, and they have escalator and they have lifts, and also they have like more washrooms because no they have they used to like diabetes patients and all they'll be using the washrooms frequently. So these are all the things where the country is being planned and done. So India has to go longer. So as a caregiver, you can provide a good friendly environment for the elderly people to prevent fall at home. So this is what I have discussed. I have just brought you to highlight on the falls. So I just move on to a topic of wandering. So wandering in dementia. Yes, of course, wandering in dementia is common. Yes, of course, it's very common among the person with dementia. So to talk about the wandering behavior, it is common for people living with dementia to wander, and this can be a confusing and frightening for both the person with dementia and also the family members and also caregivers. No, look, my mom is like she went morning and she never turned back. I could not find her. She missed the way. So there are so many complaints we have come to know. So the Alzheimer Association has estimated that 60% of the people with dementia would wander into the community at some stages during their illness. It's not like a mild cognitive impairment or severe. So at any stage, the wandering behavior is most common. The estimates of the incidence of wandering differ with rates as high as 50% in persons with severe dementia and 63 in people who live in community-based care homes. So the wandering behavior is most high, or it is being the commonest problem you can see with person with dementia. So who are all at the risk for wandering? So the person is diagnosed with dementia. So as a family member, you can able to identify some of the clues to pick them whether they are under risk for wandering or not. One is when some person are returning home late. So at the early stage, no, they may go somewhere out to the nearby temple Usually my mom will go to the temple, they will come back. But no, like last time when she went morning and just she came late. So that is one of the sign you can pick it up that my mother has missed the way to come back home. The second is forgetting how to get into the familiar places. So, commonly the people forget, they may have disorientation of where is bathroom, where is kitchen, where is bedroom within their home. So that familiar places, if they find difficult, so automatically they have the risk for missing out. Then talking about fulfilling former obligations such as going to work. So some people may say, so one of the client I have seen, so he used to say, like he was a retired bank manager. So he used to say, no, I want to go to a bank, I want to sign my check, I want to sign it. Repeatedly he says the same phrase that I want to sign a check, I want to go to my bank. So he always remembers the occupation what he has done before. In such a case, that person is high risk for wandering because when he gets the thought of going back, immediately he will get out of home and he will just try to reach the bank. So he may miss out somewhere. So then trying or wanting to go home even when at home. So like one of the client, I could say like it is his residence, but he always makes argument with the daughter that you take to my home. This is not my home. You take to my home. Take to my native. Take to my home. So this is not my. Even if you say how many times also, they never understand that this is your home. So these are all the patients are high risk, but because in their mind they think that it is not their place. They want to search of their place and they wander away from home. The next point is becoming restless and making some repetitive movements. So when they become agitated, when they become irritated, so in that time also they wander away from home. Then having difficulty locating familiar places, as I discussed earlier. Then asking whereabouts of past friends and family members. Where is my son? Where is my daughter? My daughter is there. I want to meet her. My friend is there. I want to meet him. In such a case, they may go out of home. And acting is as if doing a hobby or sport, but nothing gets done. And becoming nervous and anxious in crowded areas such as market, when you take them to market or some restaurants or to a theater or common public places, they get irritated, they get sometimes anxious, agitated because no, like they have that anxiety in mind by seeing the crowded places. In such a case, there is a risk for missing. So the other risk person with dementia who are under risk for wandering or male gender, because quite common like male people has gone to occupation as usually they are most of the time they spend out of home. So male gender are at higher risk and younger age when the person with dementia are in the early onset like 55, 40, 50 like that no, because those people are being with mobilized, they go to the market, they go to the shop, they do in every activities independently, and all of a sudden when the memory loss started they can't sit at home, they just keep wandering. And when the score like MMSE is mini mental status examination, which we do a brief screening, a memory screening assessment is done for the person with dementia to diagnose them. When the score is below less than 13, so they have the higher risk. And there are different types of dementia. And Alzheimer is the most common type. And Alzheimer and Lewy body dementia have the higher risk for wandering when compared to other types of dementia. And dementia when they have person with dementia when they have some visual spatial disorientation, they can't, for example, if the mobile is there they can't locate the mobile and pick it up. They have some difference in that spatial, the space between the objects and the eyes. So in such a case they may have the risk for wandering. And when the patient becomes agitated, when the patient is on some psychotic symptoms like hallucinations, some hearing voices, like somebody is calling, my daughter is calling, let me just attend to her, like that, they will go away from home. And when the person has any substance abuse also or under the high risk. And causes for wandering. Why the person with dementia have the complaints of wandering? One is memory loss. They might set off to go to the shop or visit a friend and then forget where they are going and where they were going. So these memory loss are very common for the thing. So that is why they go to the shop, then they forget why I have come here. So for what purpose I have come here? Where is my home? Which is my street? Which is my son's contact number? They just have the memory loss. So that is why that is the increased risk for them. Finding or doing something from their past. As I have discussed, I am the bank manager. I want to go to bank. I want to sign a check and confusion about where they are. So they do not understand that this is my home. I have to be here. So that confusion may make them to go out of home. Nighttime confusions may also arise. And sometimes, no, always being inside, they become boredom. They become less energetic. They may feel depressed and sad by looking into the four walls. So that's why they may just exposed to outside agitation, feeling uncomfortable by inside, and continuing a habit. For example, like previously they go out for a walking to the park, and now the family members are restricting not to go. That is how the risk increases. And these are all the risks. And as a family member, as a caregiver of the loved one, what is your responsibility to reduce the risk of watering? One is engage them in meaningful activities. That is most important. So you can plan some structured schedule to them, like if they are engaged in some activity, like for example peeling onion, cutting vegetables, folding the clothes or anything, you can make them to engage, or coloring, painting, anything. So that when you engage them in activities, they just further to go out of the home. Wandering can be prevented. The other is, some patients know, like we call it as sundowning syndrome. As the evening time goes, the agitation and the aggression or some abnormal behaviors will get worsen in the evening. So I could see my father from the morning is quite all right, I can able to manage, but it is very difficult for him to manage after 6 p.m. in the evening. So this is what the complaint we get. In such a case, you identify at what time he is getting agitated, whether it is due to some sundowning or like. So that particular time you engage in some activities, some exercises. So in such a way you can prevent the wandering behavior. Ensure all basic needs are met. Quality, nutrition, hydration. So here, when one patient with when she got admitted, she's around the person with Alzheimer disease. She's of around 65 years old when she was in a pavilion ward in the rematch. So she used to just 2 hours once she will go out of the ward. And one time she was missed, and because here every there was a security. So then they were searching, and the family members found her in the park. There is a park is there where a garden is there. So why she has come to that for toileting? Because she was from a village, and she used to, from childhood she used to she was practiced to pass urine in the open area. So later, nowadays only we are just the using toilets and all in her home. So for that reason, whenever she has urges to pass urine, she will go to the garden area. So that is of the her behavior is abnormal behavior. We have to address all these things, then involve the person in, as I told you, like daily activities like laundering, preparing dinner, and daily plan can be created. And sometimes, no, we can use some GPS device also, so that we can, from the mobile, we can able to see where they are going, where they are coming back. They're lost also, we can able to identify them easily. So avoid taking them to busy places, which causes more distress to them, like shopping malls. No, they get disoriented. You can take them, but see to that their anxiety is not increasing, and always be supportive and be with them. Never leave them alone. That is most important. Wherever you go, Whenever you go to church or temple, even to the hospital. No, that is a quite challenging we face in our OPD, where only one attender is allowed, and the patient with dementia will be sitting, because here you could see like they have the waiting period is very long, and if the family member wants to use the washroom, it's quite difficult. So that person are left alone, and sometimes since the hospital environment is new, and they may find go missing also. So new environment or new surroundings, make them sure that you are with them, supportive, and you are with them for guiding them. How to prepare your home to prevent or to for the person having the compliance of wandering behavior. So always keep the lock and key during the night time. You can just keep the front door locked, keep the key out of sight, so that they could not reach to the key, and that will help in missing out of home. And use night lights throughout the home. So throughout the night, put on the lights. Uh, Means in the hall or especially near to the door. At least the dim light will help. And cover the doorknobs with cloth the same color as the door, or use safety covers. Use the same color. For example, I show you. So like wall and the doors are being painted in the same color, so that this is an exit door I'm talking about, so that they could not find differentiate between the things, so that they will not try to exit out of the home. So here you can also install some devices that creates alarm when the patient or when the person is walking near to the door. The sensor will senses the person reaching to the door. Then it gives an alarm, so that we can able to we are alert that the person is not left out of the home. So you can also attach the GPS device, and you can just track them over the phone also. A simple measure like use safety gates or brightly colored netting to prevent access to the staring or the outdoors, and always some excessive stimulation no will make them agitated to go out of the home, so that you can prevent the noise levels also. And label all the doors, like for example bathroom and kitchen, you can put it in a different color door, or can put it like a symbolic representation to make them this is orient to the each room. And like as I told you, like retired bank manager who always says, I want to go back home, I want to sign a check. So if the check is on the table, he immediately gets the clue. Like, okay, if he sees the check, I have to go home, I have to go back home to my office, I have to sign my check. So like that, the triggering materials can be out of sight, like car key, bike key, wallets. Some people use like codes or whatever it may be, whatever they are used to have before when they are going out and all. So that things and all can be kept out of reach. Do not leave the person alone, and give them a safe place to walk. So commonly we come across patient family members telling, sister, I'm going for work, so I could not affordable, because all these devices, most of them I have shared, like it needs some quite a money, affordable person can do to it. But when we see about a coolie worker, where the husband and the wife both needs to work, and the family member are left alone inside the door, kept locked most of the time. So plan ahead. How can you plan? So first, when the person with dementia is there at your home, definitely inform to your nearby neighbors and families and friends that she is of having such a problem, and discuss with them, so that will help. What say when they even they when they go out of home also, they can be brought back home. So recently one history we have come across, that my father is living in a village. He has a wandering behavior. So there were no one else, only the relatives in the nearby houses are taking or providing food and everything. And he has a wandering behavior. So whenever he goes out and missed his way to come back home. Every people in the village or all the people are known to us, and they just bring back my father to his home safely. But I'm just quite worried, sister, because I am living in a Bangalore city. So if I want to take my father to my home, I am living in an apartment, and here all houses are similar. Even it's quite difficult. I'm living near the busy road, and at village he can be safety wherever he wants us. He can be come back home. He can be brought back home. But here I'm very much worried how to take care of my father. So this was a worried story narrative. No, we have got from the patient relative. So you can also have an ID band with name, contact number, and address. You can put a tag over the neck, or you can keep some chit in the pocket. So when he missed somewhere out, some people may help in reaching home, and always inform to the nearby police station. That is more safe, and know the person's neighborhood. Then create a list of places where he can. My father always goes to church. My father always willing to go to bank. So identify the places where they go. What is their favorite place? And also in one instance at a time you can also visit your psychiatrist or the doctors for any pain medications, or some medications may also help them in preventing and wandering behavior. So as a family caregiver, you have to understand that they are not doing deliberately. They are not, this is a part of their illness. So that you have to understand. Most of the family members, no, I could hear from a daughter-in-law saying that he knows these are all the things he knows very well, and you are telling that he doesn't know anything. So they are not doing deliberately. They are not doing they are out of their mind. So that you should understand first. Many families insist on using sedation, confinement, restraint, tying them, chaining them, or giving them more medicines for them to be arrested at home. That is quite what's a worsen condition that you should never practice as a family caregiver. Based on the severity of dementia, the attitude of caregivers, the nature of wandering and its consequences, management of wandering can be individualized. So it's not common for all. It's like trial and error method only we can able to try. Okay. So always you go with ABC analysis. ABC is antecedent behavior consequences. For example, if my father is going out, he is having wandering, you should analyze at what time he is going. What is the purpose of him going out? So in what way I can help him to go out? So one father is one person, no, he's telling like I'm very much bored, I'm just depressed, I could not see the four walls, so I'm just keep on going out. In such a case, you should the family members has to accompany. Yes, I will also come with you for a walk. Let's have a half an hour walk and come back home. So like that you can modify the behavior. So at last I would like to show some pictures. As I told you, first you should analyze, describe the measure of what is their wandering behavior, in what context they are doing, at what time they are doing, what is the consequences, what are their triggering factor, all these to be assessed first. Then analyze. So how can you explain this? Is there any comorbidities? Is there having any pain or any comorbidities? What is the reason for wandering? All these you have to analyze. Then you have to treat accordingly. Then evaluate whether this has been working well or not. So everything is tailor made according to the person problem. You can uh, modify their behavior by making some trial and error. So to conclude, I'd like to say safety is a cheap and effective insurance policy. Prepare and prevent. Don't repair and repent. So safe home, happy life. So it is in the hands of yours. It is in the hands of every caretakers to provide a safety environment for the safety of the person with dementia. So I'll end up this. I'll just open the session for any queries or suggestions.
Ma'am, there was something you mentioned about just before warning bells above doors, about painting the walls. Can you just show? I missed that one.
So regarding painting the walls, I say like the like the doors, for example, kitchen door, washroom, you can just paint in a different color. You can make some pictorial representation, make it out. This is toilet, this is kitchen, so that no, they will not get when they get disoriented, they may get oriented. Oh, this is washroom, this is kitchen, and that confusion may their anxiety and the confusion may come down. The other point is like when the person is having a compliance of wandering behavior, so you can just exit door can be painted to the wall as such same color so that the person cannot able to identify and just when you are not there or when you are sleeping inside your room, the person cannot open the main door and they cannot exit in the night or without your absence. In such a case, that will be more helpful.
Understood.
Hi, ma'am. This is Maithili here. My dad is around 83 years old and he is suffering with Alzheimer's. I just want to ask only one thing. Whatever you told, yes, sometimes, but most of the times he says he doesn't want to go out anywhere. He just goes and sleeps. Is it okay? Sleeping too much in a day is fine? He sleeps even in the morning around 5-6 hours entire in the morning, and then even in the night also he goes and sleeps. Is sleeping too much is good?
How is his physical mobility? He can able to walk without
He
support.
does everything all by himself, touched by God's grace. He goes to washroom. He eats himself. If he is hungry, he knows where the food is kept. He goes, eats everything. But most of the times he's like sleeping. So I do all the activities, like coloring. Take him into the kitchen for peeling, all those little small things. And he does a lot of these chanting of mantras, whatever is he's able to recollect. But sleeping is too much. Is it okay if he sleeps?
So usually we doesn't what say go with sleeping throughout the day. So
Okay.
one thing you are trying your level best to make him engaged in activities. You just think about or analyze his preferences, whichever he likes the most. As you told, like
Okay.
mantras and all, it's so you can make him sit in a hall. You can play some audio of mantras or something, or you can play some videos so that he can at least spare some time out of the bed. And
Okay.
you can also try him taking some nearby temples or churches, whichever he prefers. So since he is good in spirituality, you can try. You can just think about, analyze his preferences, and you can because coloring, for example, we say coloring, but most people will not like coloring. So you go with according to his preference, likes and dislikes. One thing.
Okay.
The second thing, better you can also consult your doctors because some medications may cause more sleep.
Okay.
So you can also go with that. For example, I say like some medications, no, you can give the time. Like for example, at evening at 8 o'clock, you can give so that the your father can go after 10. He may go into a deep sleep. Otherwise, if you are giving the pill at 10 o'clock and 11 o'clock, till morning 7 and 8 o'clock, he'll be drowsy. He cannot able to come out
Okay.
of the sleep.
Okay.
Only
Okay.
that the timing of the medication can also be checked, and also the dosage and the medicines can also be checked because that may also one of the contributing factors for more sleep during the day.
Okay. Okay. Okay, ma'am. That's what I just wanted to ask you. And whatever you told, no, he's good coloring person. So he does a lot of coloring. He is, I've given him mandala, which we have framed and I've kept it over there. He does a lot of little painting stuff. He reads newspaper. He cannot, but he at least reads like a child. How, they're trying to make up a word. So he's trying to do. Only the thing is, when he's not in Nightingale for the day care, the rest of the time he's sleeping. So even if I ask him, no, come, we'll go for a walk and all, he'll say, no, I'm very tired. I don't want. And if I tell him we have to go to the hospital, he says, no, I'm happy staying at home. You go and come. And he'll go and sit, and he's not ready to get up from the chair.
Okay.
So that's the thing.
Yeah.
Okay, I'll keep this point of not, making him to sleep. So I'll make him to watch some movies or anything. 10-15 minutes he'll watch, and then he'll just go and sleep. So,
That's
and
fine. Like all of a sudden you can't make a change in the routine. So slowly, one day 15 minutes, then after a week, half an hour. So slowly you can make engage. The other point, never, for example, if you're giving any mandala book or coloring book or anything, no, don't give in his don't allow him to do in his bed on his bed only.
no, ma'am. He sits on the table. I've made a separate
Yeah,
table.
better you practice that. You can just
Yeah.
bring out of the bedroom so that he just
Yes.
prevents that.
Yes. And he does a lot of acting also, saying, I'm sleeping, I can't get up. And then I keep watching him in the camera, but he's just not sleeping. He'll be just lying down. And if I go near him and call him, then, he just closes his eyes and starts sleeping. So that's the thing. Anyhow, I'll try this, to keep him more active and make him not to sleep more. Thank you. Thank you, ma'am.
Good afternoon, ma'am. This is Satish here.
Yes.
Yeah. Thank you for your presentation, ma'am. I just have one query that my father is suffering from dementia, and so what are the activities which we can put him through to make him aware of the dates, months, names, and all? He's actually forgetting a lot, and calling anybody by name, he's not remembering. If we call somebody's name, then he can identify, but he himself will not tell the names. So what are the activities we can do which can help him to actually have some kind of memory, and
Yes,
so that
yes.
he completely should not forget
So,
everything,
yeah.
the date and names and
Yes.
everything.
So for this, we need a reorientation. So it's not like one day telling that it is the month of October, November. No, repeatedly you have to tell them. You have to reorient them repeatedly. So that gives them that is more benefited for them. So one day if you say like today is October, today is like this is winter season, and tomorrow you like no, yesterday I told you no, you tell me what is the season. No, it just creates anxiety in them. So it caused confusion in them. So instead of asking such type of questions, you can just put a big calendar, day calendar, no, with date and month in a big numbers with big letters. You can just put him in front of his bed or something. So as soon as he gets up in the morning, you can tell him that today is this day, today is October, this month is October, this is whatever he asks you questions. No, you tell him repeatedly. So every day you teach him. So that is how they will be getting oriented also, and they will be out of anxiety also.
Okay. So the date, day, month, that kind of calendar we can put, bigger calendar.
Yeah, you can have some big calendar near to his bed, and every day he wakes up, you have to reorient him. This is the day, this is the day. Like you have to keep on telling him.
Okay. Okay, sure. I mean,
Ma'am, there is a question in the chat box.
Yes, yes.
It says that my mom always keeps wandering inside the house in the night. 2 times she has had fall in spite of keeping the lights on. We are not able to sleep in the night. How to manage?
So one thing we have to check whether the person with dementia is sleeping during the daytime. If sometimes they sleep during the daytime, they get disturbed sleep in the night. So first you have to check to it whether throughout the day they are kept busy and active. So by tired, automatically they go to sleep. That is one point. The other, you have to check for what reason, whether they tell something. Sometimes, when the patient is hungry also, they come out of bed and they just keep on wandering inside. So you have to check whether the basic needs is met for them, whether they want to use washroom. If they are diabetics, they may use the washroom frequently, or if they have any urinary problems, or if they are hungry. So you just assess to it whether their basic needs are met, or just try to analyze what is the reason they are just keep on walking. The other thing, also you can consult with the doctor, because the person with dementia will have the day and night confusion. They do not understand the night as night, and they think, they just perceive the night as day. So that is why the person will be keep on awake throughout the night. So you can also check with the doctor, and you can just go with any medicines that also will help them to sleep better in the night time. Yes, ma'am. Am I answered to your question? Anything more than that if you want to ask?
Ma'am, can I ask my question? Like a part of it got answered as you were responding right now. That sundowning effect, there's a high experience of in the recent past with my mother that she wants to go out. There's no negotiations. So distractions are also not helping, and that gets quite challenging to tackle. Wanted to check if there's a way to support this with the medication, or is it completely only through distraction?
So it depends what behavioral disturbances they have. Some like sundowning is it's like we call a group of symptoms can be present, like getting agitated more in the evening, getting restless, or getting aggressive, abusing others, not cooperative. So we have to assess like what are the behavioral symptoms. So to some extent, the medication may help them definitely. And the distraction is also equally important. As I suggested, you have to keep them engaged in some activities whichever they like in the evening. So otherwise you can take them out during the evening to the nearby place, whichever they like, nearby park or some have an evening walk. So like that you can distract them.
The thing is, she does have a evening, plan with going to the park, and there's like a exercise group. So she does go there. However, recent past, we have noticed that it has become more and more that is one thing that is in her control, right? So I totally understand that there's so much loss of control in their life. So she recognizes that the going, like getting up from the chair. So there will be high resistance for that. She's like, no, I will not go for the exercise. So she will just not budge in, or there are times she will just say, I want to go to some, um, I want to go out. I want to go to this temple, which is not nearby. Like it's not like practically possible to do it on a daily basis. So every day evening at that time, that, that bout of, experience will begin that, no, I have to go. So on certain days, it gets extremely challenging, because there are moments of no, you're not listening to me, I will get up. So, and there is a risk of having a fall, like, so today's topic kind of got connected in many ways. So there is a risk of falling down. So even if we talk from that perspective to her, of course there's no reasoning, yet what is happening is, no, I will not fall, God will save me. So there is that high component of transferring that on a higher power, and the risks associated, and of course there is no negotiation around it. Yet out of the concern, to see how else it can be tackled or handled, I just want to put it out for any thoughts or suggestions as to how that can be dealt with.
So, as a caregiver, you have to understand that their behavioral problems will not be same all the day. So, you have mentioned that it will be one or other day they will be highly cooperative, and one other day they're much challenging for us to control them. So it's like fluctuating behavior we can see with them. So also you have mentioned about the nearby, she's requesting to take to the temple which is far away. So in such a case, you can take her to the nearby temple, because some people know they will not recognize or they may not understand that this is what the temple they say, because they have some cognitive disturbances. In such a case, you can just comfort her by taking to the nearby temple and saying that yes, I have taken you where you told or what you have mentioned. So like that way you can also manage her the nearby walk, because no, she may not understand that this is far away. If you say like it is long, no, so that distance and those things and all is there, they will not understand. So they want to go to the temple, so you can take her to the nearby temple and say that this is the same temple what you have asked for. So in that way you can also manage. And uh, like if sometimes, for example, if they are very rigid, like you just leave her, never force them to do any activity. So one or other day, as I mentioned, they will be very rigid, they will not be cooperative. So in such a case, you put them, what say, like, let them be what they are. And also you can put some, what say, like, melody song or some music which soothes their mind. So you can try it out the other measures, no, to make them calm down.
Sure, ma'am. Sure. It's a very understandable, like you said, overall, she's quite cooperative. However, these are those moments where, it gets quite tricky and challenging. Mostly, she's cooperative. So these are such moments where it gets challenging, and I recognize most of us are experiencing that in one way or the other. So yeah, it's totally understandable. Sure, ma'am. I think the music thing is helping. So just to play it on the background, that would probably help calm down the nerves in many
Yes,
ways.
yes,
So I'll probably bring in that aspect and leave it. Like for example, besides the temple, there's this experience of she wants to go to her other daughter's house. So that way, and she wants to pack the bag right now, wear a sari right now. So that's what comes through. So it's just like allowing her to pack the bag, like just that
yeah,
experience of having to put the clothes into
yes,
the
yes,
bag, and
yes.
that experience that she's getting to do that, because that was her that was her go-to way of being earlier, and now she's not getting to do that frequently. So it's understandable. Thank you
Yes.
so much, ma'am.
Okay, thank you.
Ma'am, we'll wind up the session.
Yeah, sure.
Sure. Okay. Am I audible?
Yes, Mahima.
All right. All right.
I have one question, one small question, madam.
Yes, sir.
Sure, sir. Please make it quick. We would like to end. Yes.
I will. My name is Nagaraj. My wife is suffering from dementia. She is 76 years. She normally sleeps very well at night. Some days she suddenly gets up and says, I saw somebody coming into the room and then taking away some of the things in the almirah. And I just asked him to get out of the house. This sort of a thing she says and again goes back. And when I wake up and ask her to sleep, it is only this time, the 2 o'clock or 1:30 in the night. She again goes back to the bed and sleeps, and she gets very good sleep thereafter. This sort of a thing has been happening once or twice last week, and this was never occurring earlier in the course of her dementia period so far for the last 4 years. What is it? Why is it suddenly these things are happening, madam?
Sir, there may be chance of, we call it as psychotic symptoms, that they may have some hallucination, in the sense they may see the people where there is nothing is there. They can able to hear some voices when nobody is talking. So in that we call it as hallucination. And also they may develop some suspicious behavior, suspicious thought in their mind. Somebody is trying to harm me, somebody is trying to kill me, somebody has entered my room to take my things away. So these all the suspicious thoughts, no, they may develop this. We call it as psychotic symptoms. So this is one part of the illness. Like not every patient have this, but one or other way in moderate or severe stages, the patient may develop these symptoms. So
You
that is why
may develop.
this symptoms, sir, like suspiciousness or hallucinations. No, when nobody is there, she can able to see some strangers standing there. She can able to see some animals standing there, but
No.
we can see that nothing is there. So, but they can able to see that. So this is called hallucination. So this is a part of illness some people may develop. So in such a case only their anxiety will increase more. So as a caregiver, first you have to reassure them that yes, I'm here with you. I'm here with you. Don't scare. Don't afraid. Nobody is here. Like that, you can give reassurance to them so that will calm down her anxiety first.
Okay.
So, and the second part is you can also consult with your doctor to with these symptoms, and they can also adjust with some medications that will also help them to come out of the psychotic symptoms.
So some medicines are there for such a situation
Yes,
to,
sir. Yes, sir. Yes.
to calm it down.
Yes, sir. Medicines are